evening and welcome again to our next session in MPHA's 2020 annual conference, Leveraging Technology to Address Social Determinants of Health. My name is Becca Bolus and I'm Executive Director of Maine Public Health Association. I'm excited to be joined today by Melinda Thompson and Deb McGill. Melinda is a population health specialist at Maine Medical Partners, and Deb is the Senior Director of Population Health at Maine Medical Partners. A few reminders before we get started. We are now offering closed captioning. It's accessible in the left-hand menu of the conference website. Please remember to take the evaluation, which is located in the session page. And if you have any questions for our presenters, please use the Ask feature on the conference website. We'll take questions at the end of their presentation. And with that, I turn it over to you, Melinda and Deb.
Thank you. So I'm Melinda Thompson. I work in the Population Health Department at Maine Medical Partners, and I'll let Deb introduce herself as well.
Hi, everybody. As I think Becca said earlier, I'm Deb McGill, and I have the pleasure of overseeing the Pop Health Department at Maine Medical Partners and working alongside Melinda Thompson, who will present most of what we have to offer today. So thanks for all your work on this, Melinda, and thank you for letting us present to you today.
Great, thanks. So just our disclosure slide, while we will be talking about some technology tools today and use specific examples, we as the presenters have nothing to disclose with regard to commercial relationships. And then a couple objectives for today. By the end of this presentation, you will be able to understand how Maine Medical Partners, MMP, is leveraging technology to address social determinants of health, which we say is SDOH often in this presentation. Also understand the partnership we have between the Pediatric Clinic and the Jewish Community Alliance, a community-based program that's local for us. List 3 benefits to using an online community resource sharing platform, and then 2 components of successful engagement with a community-based organization, such as the Jewish Community Alliance, to share technology tools and utilize them together. A little bit of background about Maine Medical Partners. Within the Maine Health system, we're the largest primary care and specialty medical practice group. We also implement practice-based care managers, so RNs and social workers, and also health coaches now who are in the practices, and that is the department that Deb and I work in. MMP utilizes Epic as our electronic medical record system, which really supports us to identify and manage patient populations, as well as identifying social determinants of health-related barriers, which may be collected by various members of the clinical team, providers, MAs, other care management and care team support staff. And they may be finding this information at multiple points across the care continuum, inpatient, primary care, and an example that we'll go into later is at MMC. The pediatric clinic screens for food and diaper insecurity at regular visits. And so we'll use that as, we'll go into more detail with that later. So as a system, we really needed a standard and integrated process to effectively and efficiently address these identified social determinants of health related barriers. And so in November of last year, 2019, MMP launched a resource sharing platform called MaineHealth Community Resources, powered by Aunt Bertha. And this technology is what we'll be talking about today. It allows us to better connect patients with local community programs and supports. Some more information about this tool. So it's an online resource sharing platform that offers users kind of this one place, a large directory of free or reduced cost social service programs. And the data is managed by an Aunt Bertha, depending on where you're from, I suppose. A data team that works nationally. And so it's really the Aunt Bertha data team that helps to manage the information. But what's great is that it allows translation, and so you can translate the whole page before accessing this information, and really helps us when we're printing information to give to our patients in multiple languages. This platform is also, like I said, one place to search for a lot of different information, and you can do that in many ways. So by keyword, by zip code, by service category, such as basic needs, medical care, food, and that sort of thing. This platform also allows communication between the people and providers who are using the platform to connect patients with programs and with the programs themselves. And so the example that we'll go into later shows how our providers and programs using the platform can share information bi-directionally, which is really great to inform patient care. Also, analytics allow us to track all interactions on the platform. And so how are people searching for resources? What are they searching for? And then if we're using the platform to make patient connections, how often are we closing loops, closing the gaps that we've identified? And then lastly, it's available online, so it's available anytime. Our providers and care teams use it through our medical record system, Epic, so it's Epic integrated, it lives in Epic. And then this platform is also available to our patients through MyChart, which is our patient portal. And then lastly, with this background is our project team, since it began implementation last year, we've been guided by the MaineHealth Center for Health Improvement. And that's great because it is allowing us to work across the MaineHealth system. And so since this platform is live in Epic now, it's available to all of the local health systems within MaineHealth and additional stakeholders as well. And so I think actually after this presentation, you'll be hearing from Western Maine and how they're utilizing this platform as well. So the Diaper Bank is our pilot program that we really wanted to highlight. And it's the Jewish Community Alliance, JCA, that offers the Diaper Bank in Portland. And it's really the only diaper bank in Southern Maine and only one of two across the state. And they're great because they offer numerous other community programs around education, also a food bank, and so they're a really valued program in our community. We were working with the MMC Pediatric Clinic to create a new workflow, and this was shortly after the MaineHealth Community Resources powered by Aunt Bertha platform was implemented last winter. And so this new workflow includes the pediatric clinic screening patients for diaper insecurity at regular visits. And so at well child checks and also at acute diarrhea visits. And so patients are asked in the past 12 months, have you worried about how to pay for diapers? And they answer that question. If they need support, staff will help them do that. And then the medical assistant will document this in the medical record. If someone screens that they need help with diapers, the provider will talk about this with the family. And then depending on if the practice has some emergency diapers available, they will distribute those. But if whether or not the diapers are available, what the provider will then do is access the resource sharing platform, so that MaineHealth Community Resources powered by Aunt Bertha platform for us. And this allows them to make a connection to connect the patient with the community program. What happens next is everyone gets a confirmation email. That was one of the benefits of using this platform is that auto emails are sent out to the provider, the patient, if they have email available, and then the Jewish Community Alliance, the program itself. And that's just kind of a notification to flag that this connection has been made. So then JCA receives the referral in the platform. And because of a lot of the work that we did with the JCA to get them really engaged in using the platform, they will then, once they receive the information from the provider about the patient so that they can reach out to the family and try to contact them for offering services, JCA will then go back into the platform and update the status or outcome of this connection made. And so some of those options within the platform are pending, got help, the program needs client action, the program couldn't contact the patient was no longer interested, or the patient was referred elsewhere. And so these are the options that JCA can select in the platform. And then what's great, like I mentioned with the bidirectional communication mechanism, the provider then can go back into the platform and see this outcome that JCA made. And so it allows for both the provider and the practice to get on the same page with the outcome of this connection made. And obviously the goal is to close these loops, close referral loops, so that we make sure that patients get the help that they need, or if something has changed, that they get the new help that they need. And so, right, the provider can follow up as needed for patients unable to get help. And this last point also kind of reinforces that as a team, it's useful to run analytics and then monitor the platform usage so that we're tracking our ability to close these gaps, or if not, what can we do to better close the connections made. And for us, this pilot coordinator was a role that we fortunately had to just kind of help pull the group together and look at data together and kind of move the pilot along. So we have some lessons learned as a result of this pilot with the Diaper Bank, and some of them are, I think, can be applied to when we start working with additional community resources in trying to get both sides, provider and community, to engage and use the platform. The first lesson learned is to really support the program to engage in using the platform by scheduling regular check-ins. So for us, that looked like team check-ins as well as one-on-ones, because there was some technical support needed in the very beginning, and then some follow-up that was useful to look at the data, which is on this slide that I'll talk about in just a minute. Also, we learned that you can improve the effectiveness of connections made. And so at first, when we were placing referrals through the platform, we only sent patient information, patient contact information. But we quickly learned that it would be super useful to know the preferred language of the family and also the parent name. And the parent name could be useful for any programs where maybe the patient is the child, but when you're reaching out to the family, it's actually the parent that you want to talk to. And so it's useful to kind of have a broader context. Other examples could be how many other people in your family need support to give the program an idea of who they're working with. And so this was something that's beneficial to both the provider making the referral and also the program doing the outreach. And sort of along the lines of improving effectiveness of the connection, this bidirectional communication update was super helpful. So supporting the program to see the value in that, and then also to actually follow through with it. That was something that we really worked on. Also to reinforce the connection, right? So for us, that was following up with handouts, and then also more physically following up to the referrals placed. And that could be something that might look a little different depending on the program. Maybe they're not handouts, but maybe it's something else like a physical reminder of the connection made. But we found that reinforcing that connection was really useful. Then to also consider the full patient and family. So I mentioned it may be one referral for one patient, but there could be others that in the family that would find these services useful. And so thinking about these connections more broadly, and also linking to other community programs. So if it's not only diapers that someone needs and it's also clothing, then maybe the provider has a connection, but maybe the community program has a better connection. And so it could be kind of referral upon referral based on whatever the patient needs. And then lastly, to adapt during crisis. And so just to be flexible was something that I think our group was really great with. And so for us, when COVID happened, the Diaper Bank needed to change their availability in how they're listed on the platform. So to get a kind of visual, each program has their own listing on the platform. And so the Diaper Bank wanted to update their listing to say that actually our capacity is pretty maxed out right now. So can we change availability to better reflect that? And so that was something that we did. But adapting could look like anything. It could look like increasing communication just beyond the platform itself and to just meet more regularly as a group. But we found that was really, really useful. And what's great is the data reflects our success here. And so this is the number of referrals that providers have sent to the Jewish Community Alliance. That's in blue. It's kind of all over the place, but what I want to point out is that the green line is the percent that got help. And so for the most part, those are 50%, so half or higher of the referrals made, the patient got help. And this is good for us to know that our referrals are making an impact. But what's also important to keep in mind, and we discovered this as a team when we were meeting and reviewing the data together, that this data is actually underrepresenting or likely underrepresenting the actual amount of work done and the actual amount of need for our families, because back to kind of that the process of it only makes a referral for one patient. And so if the Diaper Bank is actually helping multiple members of the family, then that's not reflected in this data. And so this data is really underrepresenting that. So these next few slides are just all of our findings and takeaways, which I feel like most of these were covered in our previous slides, our previous talking points. So we just wanted to list them here for your reference later on. I will highlight a few, however, I feel like these ones stood out to us. So some of the benefits of an online community resource sharing platform, and I folded them here, is that the online information is one place for multiple users to go. And for us, it was really important that it could be translated into multiple languages. And so being online, being through a platform allowed us to do that. And so that was a huge benefit for us. Another benefit to highlight are the mechanisms for bidirectional communication really do help close referral loops. So what we don't want is to make connections for patients or give patients information and then just kind of end it there. So we wanted to actually see that the patient received help or that they no longer needed help. And so this resource sharing platform allows us to do that. It did take a little bit of engagement on the side of the community-based program just to understand that importance and then use the platform for this. But I think, and others would agree that it's well worth it in the end. And then documentation and utilization of the platform is tracked and data is reportable. That's sort of similar to what I was just talking about, that we really want to be able to look at the effectiveness of the work that we're doing. And in our next steps, which I'll touch on in a few minutes, is this platform tracks all usage also, so not just referrals. And so it's really good to see just what are our staff using the platform to search for. So are they mostly searching for transportation services or food services, or what is it? And so we want to know so that we can inform next steps and what sort of support do we need in the community and what sort of programs do we need more of. And so some findings and key takeaways for successful engagement. And so when I say engagement, that is supporting the community-based organization to really use the platform, because maybe it's not using the platform to the extent of that bi-directional mechanism to communicate, but we still want to engage organizations to just use the platform to share their information about their services that they offer so that our providers can find that information. And so there's a lot of flexibility in do they want to receive referrals? Do they not want to receive referrals? Do they just want to be listed? So whatever the level of engagement is, we still want to support them. And I would just highlight that I think the things that we found most useful are regular check-ins as a group and individually. So providing technical assistance as well as just sort of meeting and talking about the platform, and then also adapting during times of change. So our next steps, because I want to save room for questions at the end, is that we want to continue leveraging technology across the system. And so this is an example of some analytics that can help inform what those next steps could be. So what are our patients' most common needs? Do we have ability to close those gaps, or even think about broader support such as applying for funding or encouraging policy use or policy implementation. But we also want to talk with our providers and other staff to plan for what other programs can we reach out to and engage with to potentially do what the Diaper Bank did. That's kind of our goal, is to get the platform used to that extent. And so providers and care coordinators may be able to inform us about some of the programs that they're often referring to that we could then engage. And then networking with other organizations to complement this work, to avoid duplication. Maybe it's actually a community program that reaches out to us because they're interested in receiving referrals from our providers that way. But I think another good drivers of expanding utilization among our staff is to really build into our strategic goals, which we're currently doing this year, and then to identify and enlist champions to drive this work as well. So with that, I wanted to leave some room, or we wanted to leave some room for questions at the end. Here's our contact information. And I guess we'll leave it up to that. If not, then we can keep going.
Great, thank you, Melinda. That was a great presentation. There is one question right now in the queue, and then there's another question that I have for you as well. And I encourage folks to please add your questions to the Ask feature in the conference site. So the first question is, does your resource list include the Diaper Bank in Lincoln County?
I'm sorry, what was that? It cut out.
Does your resource list include the Diaper Bank in Lincoln County?
I don't think it does. I would say the kind of thinking about who may be a good representative for that region. We do have a work group that is, the goal of that is to work on community engagement. And we have representatives from each of the MaineHealth regions. And so I'm thinking of the representative that we have in Lincoln. And I'm glad that you mentioned that, because I feel like it would be a great resource to list, and I would like to get in touch with that person, the representative in Lincoln, to see if we could get it on.
Great.
Is that,
Awesome.
yeah, Becca, I'm sorry, this is Deb McGill. Is that question coming from somebody in the MaineHealth? I guess I'm wondering, is that question coming from the resource, the Diaper Bank itself, or is that question coming from somebody familiar with our system? Because the way we will follow up will depend on us knowing that. But Melinda is correct in that that community engagement work group would be able to follow up to make sure that they get listed. Each local health system has a representative that should be working with their local health system to make sure that programs are getting listed and constantly updated and added to the platform.
That's great. That's really helpful. And also what is helpful is that question was from Kate Perkins, and she followed up with a bit more information. Her comment is that there is an interfaith council in Lincoln County that runs a diaper bank, and she suggested connecting with the Mid-Coast Friends for contact information.
That's awesome. I would love to connect with them and share that with our community engagement group.
Great.
Thank you.
Yeah. And then in the interest of time, I think we have time for one more question. And that is, so the analytics that you mentioned running make a lot of sense for improving healthcare and health outcomes amongst your patients. I'm wondering if you can talk a little bit more about how to talk with patients about the type of data that are being collected and the data sharing between the community-based organizations and providers. What type of conversation is happening at the patient level about that?
So at this time, we're, depending on what the patient's needs are, directing them to the platform if they can self-help. So either providers or clinical staff can make the connections themselves. Patients can also use the platform through MyChart and a browser to search as well. As far as, so is your question more of, are we sharing the outcomes of the analytics with patients?
Yeah, and I think the outcomes, and do patients know that their data are being analyzed in those ways, like their requests and their searches, those types of things?
No, not specifically, I would say. We obtain consent much like we would for any other connections made before we do that on behalf of the patient. But I wouldn't say that there's a huge communication plan to patients specific to like how they're searching on it and what they're doing. It's the way I think that we've thought of it is that it's an online tool, almost like Google. It's more targeted for just the community programs. But and I think broader communication too, like we haven't had, so we've kept it sort of internal as a tool for our staff to use. And so even promotion more broadly than that. So like I'm thinking promotion to the public was something we thought about in the beginning, but we haven't yet really done much with that. But if anything, I think it would be a system conversation because it is across all of MaineHealth. And so we're trying to be more consistent in our communication at the MaineHealth level. I don't know if Deb has anything to add.
No, I would agree, excuse me, with Melinda, and we're really early in this work in learning how to optimize all of the tools available to us. And so I don't really have anything of more value to add, but it is a good topic for us to consider when we're discussing, how we manage and use the data.
Great. Thank you very much. This was an excellent presentation and some great discussion. And we're at time. So I want to thank both Melinda and Deborah for being here today and to thank all of our participants for joining. Please be sure to complete the session evaluation, and I hope you'll hop out of this session and hop back into the next one, which will be about Aunt Bertha community connections, enhancing connections between healthcare and community. And so I hope to see you back here in the next few minutes. Thank you very much.